Hi, I'm Dr. Mary Gregory with Uptown Eye Care.
And I'm Dr. Miranda Lepinski.
We wanted to create a little video for you at home so that we can help you understand a little bit more about myopia. Myopia is a word we use to describe nearsightedness. People always ask, what does that mean? Nearsighted means you're sighted for near. So you can see it near, but you struggle to see far away. Typically, we're not born nearsighted, we're born a little bit farsighted. So babies' eyes are actually a little bit smaller, and then they grow or lengthen as we get closer to 6, 7, 8 years old. At that point, hopefully the eye has stretched out to its perfect shape, and then you have perfect vision, which means clear vision without effort to see far away and can still see at near. However, sometimes our eyes continue to stretch and grow. That's what leads to myopia or nearsightedness. Unfortunately, right now, many more children we are seeing are becoming more nearsighted at a younger age and to a higher extent. In fact, the World Health Organization has now stated they believe that 50% of the entire world's population will be nearsighted by the year 2050. This is definitely a concern for many reasons. There are a lot of negative health factors with your eye being stretched too long.
There's a lot of health risk that can come when the eye is longer. Some of these risks include myopic degeneration, glaucoma, different types of cataracts, and retinal detachment. We want to make sure our kids' eyes aren't becoming too long, that it puts their eye at risk of these eye diseases when they're older. When someone has a longer eye and is really myopic, you have a 1 in 4 risk of having one of these eye diseases that can affect vision loss by the time you're 75. So even though your child can see well now or make it LASIK in the future, their eye is still longer and more at risk for health issues that can affect their vision. So that's why it's really important that we start slowing down their myopia and keeping their eye at a normal eye size for their age now when they're young. Because unfortunately, once the eye stretches and grows, we can't shrink the eye.
Of the risk factors, genetics is certainly a big one. So if you have one parent who's nearsighted, you are much more likely, but having 2 parents nearsighted, very likely that you will also become nearsighted. Those children we want to see at a really young age, certainly at 3, so we can be monitoring for nearsightedness developing.
And what's really cool now is we can measure the length of your child's eye. So we can watch it year to year or every 3 months to see how their eye is growing and even make predictions about that growth compared to their age. Something that we weren't able to do until the last year.
One of the exciting things in this area is in late 2019, the FDA approved our first method of trying to slow down myopia. Up to this point, in past generations and decades, we really didn't have any way to help slow down the nearsightedness. And so people like myself and like you
Yes, definitely.
have needed glasses since we were young and have very long eyes and are very nearsighted. In our myopia therapy, we have 3 different options that we can now utilize to slow down and reduce the amount of myopia. These options now include an eye drop option, a soft contact lens option, and a night lens option. In the future, we will be hopefully getting an eyeglass option that is still in FDA trials, but is expected to be released in 2024.
So let's talk more about those options. Our first option is atropine eye drops. That's something that's a great option for young kids that are not ready for contacts. The parent or the child can put 1 drop in each eye every night. Using that eye drop can help slow the eye from growing longer so that they don't need more and more prescription.
Of the 3, that is our easiest choice for those young children, but the other 2 options are even more effective in slowing down the nearsightedness. The next one is a soft contact lens. These are daily throwaway contact lens, especially designed and FDA approved to slow down the change in the eye. It does this by changing how the light is focused into the entire back of the retina in the eye, and it reduces the stress that causes the eye to continue to grow. These have been very effective in reducing the nearsightedness by at least 50%. In our office, we're seeing it even at a higher percentage. So it is slowing down the axial length growth and slowing down that prescription, holding kids steady at a lower prescription. Our third option is a night lens. These are lenses that are worn overnight while your child is sleeping, and it also reshapes the eye to allow for perfect vision the next day. These lenses have been around for decades and have been successfully used, especially in athletes and people who don't want to wear contacts during the day and still have perfect vision. What we're finding now is that we can alter the design slightly and also achieve a reduction of the myopia change in children. So these lenses are worn overnight, taken out in the morning, and your child has perfect vision during the day. This is great, especially if they are in a lot of contact sports or swimming. It's a fantastic option, but also is very successful in slowing down the nearsightedness and the myopic change. With your child becoming more nearsighted, we're going to want to be checking up and following up on them a little bit more often. So once you enter our myopia therapy, we will start with fitting either the contact lenses or prescribing the drops for you. And then we will typically see your child back that first year, especially every 3 months, measuring axial length and their prescription. Once we get to the year mark, a lot of our patients haven't made any progression in their nearsightedness. And if we've successfully found a way to slow that down, then we may only see them twice a year moving forward. So why are children becoming more nearsighted? Well, there's been a lot of research in this area, and it comes down to a couple of different theories that are holding pretty true among many research studies. One of them is that children are not spending enough time outside, and sunlight is really important for our growth and for our development. The opportunity to look off in the distance is fantastic, and that is very helpful, but the sunlight itself is what is helpful. So the studies are showing that somewhere around an hour and a half to 2 hours a day of outside time is really critical, especially prior to 12 years old, to slow down the progression of myopia. The other thought is just the increase of near time and screen time. It's not necessarily even the screen, it's all close-up work. So even children that do a lot of reading, playing games, but again, a lot of screen time within arm's reach here. Anytime we are looking within our arm's reach, that puts additional stress on our eyes. Our eyes were designed to be distance viewing, and we were supposed to be off looking far away. And that's very relaxing for our brain and for our eyes. But we spend so much of our time at up close and at near, and that is causing some visual stress, which is also elongating the eye, creating more nearsightedness. We are very passionate about myopia and about reducing the effects of myopia, as Dr. Lepinski said, in our community. And so we have committed to this. We have now instrumentation and technology that measures axial length. The axial length is the measurement of the length of the eye. We know what's normal at each age, and we are able to record this on every child as just part of routine exam.
And that's our whole goal, is we don't want your child to become really myopic and need glasses for everything. We would love to help slow down your child's nearsightedness with one of our myopia therapy programs. To enroll in one of our myopia therapy programs, please email Dr. Gregory or Dr. Lepinski at Uptown Eye Care. If you would like additional resources or research myopia, please check out these additional resources listed on this slide.